Hello everyone, welcome to Complete Course videos. Today we are looking at the PDHPE syllabus and we are specifically looking at Core 1 Measuring Health Status. So essentially by the end of this video you will be able to understand the role of epidemiology. You'll also understand the different measures of epidemiology, critique if epidemiological data actually provides a holistic approach, and answer multiple choice questions about epidemiology along with short answer questions about measuring health status. So let's have a look firstly at what is epidemiology. So epidemiology is the study of patterns and causes of health and diseases in population, and essentially it's not just the study of these things but also the application of the data that is collected to actually improve the health of a nation. And collecting statistics about different populations, so population groups and their health, actually allows for the identification of health issues to implement health promotion in order to improve Australia's health. So there are 4 measures of epidemiology. Firstly, we've got life expectancy. So life expectancy, as the name suggests, is the average number of years that a given gender is expected to live. And currently for females that is 84.5 years, and for males it is 80.4 years. What we also see, and this is something that epidemiological data shows us, is that there is a huge inequity between non-Aboriginal and Torres Strait Islander Australians and Aboriginal and Torres Strait Islander Australians. So that means that the First Nations peoples, their current life expectancy for females is 76.5 and for males it's 72.1. And therefore we can see that inequity and the gap between the life expectancy of both groups. The second measure of epidemiology is mortality rate. So that is the number of deaths in a given time. And then we've got infant mortality rate. So infant mortality rate refers to the number of deaths of infants under the age of 1, and it is expressed per 1,000 births. And finally, morbidity. Morbidity is the level of disease, injury, or illness within a population. And so therefore the 2 measures for morbidity are prevalence and incidence. Prevalence is a total number of diseases, or number of cases rather, and incidence is the new number of cases that are being documented. So here is some data from 2 very reputed websites. So we've got Our World in Data and the Australian Bureau of Statistics, and it showcases some facts surrounding the life expectancy of Australians. So in the first graph that you can see here, this is the life expectancy, the average life expectancy around the world, and we can see that there are certainly disparities here between developing and developed countries. And that's what epidemiological data shows us. And so we can see Australia, we are pretty good in this map. So you can see the life expectancies averaged here in the darker blue around 80, so it's above 80 years, so about 82 to 86 years. The same can be said for the United States, for some of the European countries over here. However, we can see that within developing countries, there's certainly the life expectancy is much lower, and so that showcases a lot about the global health inequities that are being experienced. But our focus in this module is to look at the health of Australians and the epidemiological measures for Australia. So let's have a look at this graph here now, and we can see that this showcases the life expectancy years, so in years at birth in Australia. And in this graph, we can see that it begins in the 1900s, and data is projected, or rather, it's not projected yet, but it showcases data up till 2020, so up till 2021. And there is a very prominent, clear trend here that life expectancy is increasing. And what we can also see that throughout history, the life expectancy of women has been higher than men. And another thing that you'll notice with this data is that so it sort of shows us the life expectancy until 2021, similar to this graph as well, and that is because it is actually hard to it's hard to actually get like very recent data, very up-to-date data, so data for 2022 or 2023, and that is because that epidemiological data it takes a while to actually be collected and analyzed. And so that's something that we will be discussing quite shortly. But from these two graphs, we can see that in Australia, life expectancy is increasing, and it is increasing at a good rate. So we can see from 1900s up till 2020 that there has been an increase of almost about like just below 30 years. And so that is thanks to technology, that is thanks to medicine, so developments in medicine as well. And that's something we'll also be discussing a lot more in this call when we talk about the health inequities that are then associated with the data. So let's now have a look at the importance of epidemiology. Why is this data actually relevant? So firstly, epidemiology helps us identify and measure the basic health status of Australians and also the major causes of disease. And so by knowing the major causes of disease, we are able to encounter them, we are able to create programs and initiatives to counter them. So that's the first thing. Secondly, it also allows us to see the inequities that are apparent between groups. And that can be done by comparing the results. So sort of like for life expectancy, we very briefly had a look at the inequity between non-Aboriginal and Torres Strait Islander Australians and Aboriginal and Torres Strait Islander Australians, and the huge gap between life expectancy there. It also allows us to identify areas of priority, and that is those could be conditions or diseases that actually affect a larger part of the population and therefore should be prioritized in comparison to other diseases. And that's something again that this module sort of focuses on, is considering how do we actually identify distinct priorities in health based on epidemiological data. It also allows us to evaluate the effectiveness of treatments. So by implementing programs and initiatives and then considering their progress and their effectiveness, we can obviously determine whether or not they had a huge impact. And what we will see again within this core is that there is a huge focus on shifting from treatment to prevention, because prevention is better than cure. And so by understanding the effectiveness of prevention programs, we can actually consider whether or not, or rather we can actually consider and visualize the effectiveness of these prevention programs. And once we have that data, we can then implement it to establish further prevention programs. So then we also use these measures to inform our decision making of many groups, including governments, NGOs, manufacturers of health products and services, and individuals. So what that means is, in all aspects of health distribution, we would see that everyone is using this data to make decisions. Governments are using this data to create programs that are going to be, that may be more beneficial to individuals, or that may target a higher proportion of society. NGOs are obviously working to implement programs, especially in certain communities that require them more than others. And of course, manufacturers of health or services would be using this data to consider what products need to be made, and that comes in from a business point of view. But individuals are using this data to, for example, understand their own lifestyle behaviors and choices, and if they have knowledge of the fact that within the population certain diseases are more prominent than others, like chronic diseases, they can make decisions to implement better and healthier choices in their own lives to save themselves, and put themselves in a better position against these diseases. So everyone can use this data, and everyone does use this data. So let's now have a look at the limitations. So we've looked at how important it is for us to actually collect it, and we've looked at how it can showcase how it can showcase the disparities between different groups, and also tell us which conditions and diseases are or should be a priority. But where are the limitations here? Why is it not the perfect solution? So firstly, obtaining data, like I alluded to earlier when we were looking at those graphs, that is difficult, especially in emergency situations. So perhaps during, and a really recent example is COVID-19. So during the pandemic, it was hard to obtain, data as soon as, like, it was hard to obtain current data. And we were seeing, for example, the number of cases in certain countries, and the number of cases in states and so on, but we know that that data was not a full snapshot, because it's hard to obtain data, especially when we have individuals who were not always getting tested, or those who were not registering their cases. And similarly, we would not have access to data from, for example, rural and regional areas in comparison to more metropolitan and urban areas. And we also saw that in the pandemic, data surrounding the efficiency of the initiatives and also of then the vaccine, it came a bit later. So not as late as it generally comes because of the urgency surrounding the pandemic, but still a bit late. It took time for it to come through, and that's one of the limitations of epidemiology. It is hard to obtain reliable and valid data in time, especially in situations of emergency, and analyze it in order to then come to conclusions that are going to have a positive effect on the situation. Secondly, the data is objective. So what we can see is that it is showcasing us, like, it's quantitative, it is showcasing us what is happening, it provides us with an excellent snapshot. However, it does not give us a holistic view of the determinants of health. It does not give us a holistic view of the quality of life that individuals are experiencing, which actually then affects the data that is coming through. And so epidemiological data does not do that. It's very quantitative. It does not consider the more qualitative reasons behind certain behind the reasons for certain conditions to be more prevalent others, for different population groups to be experiencing more inequity than others. What are the reasons behind that? So that's something that we don't see with epidemiological data immediately. So it's objective, and it's also observational. So it does not explain why the trends are occurring, but it does give us good insights to actually counter those. And healthcare workers or health workers in remote communities often actually lack the resources to conduct adequate data collection. And they also have lack of access, can then present difficulties in communicating their data. So their lack of access can affect the distinct ways in which they can communicate with not just their local institutions, but also state and government institutions to allow for something to be done in situations. So this is where we can see that there is again inequity between those living in rural and remote areas, and also and those living in metropolitan areas as well. So epidemiological data certainly has its limitations, and that's something we have to explore, and we have to explore whether or not it gives us a full snapshot of health. And in this case, we can see that it doesn't quite do that. It gives us certain insights into the trends and statistics. However, it does not tell us what the underlying causes of those issues are. So let's now consider and put all our learning into practice, and let's begin with a multiple choice question. So this question is from the 2022 HSC paper, and we have to identify which row in the table shows the current infant mortality and life expectancy trends in Australia. So luckily you would not be asked to provide statistics as such. They always strengthen your response, but knowing trends is adequate. Knowing trends is adequate for both multiple choice and short answer questions, but it is good to have some statistics with you. For example, knowing what the life expectancy is for First Nations people in comparison to non-Aboriginal and Torres Strait Islander Australians. So in this case, we can see there are 4 options. So infant mortality rate is decreasing, decreasing, increasing, or stable, and the life expectancy rate increasing, decreasing, stable, or increasing. So we need to consider which two essentially fit here. So infant mortality rate, think about the fact that in Australia we obviously have public healthcare now. We have public healthcare, and now we're also seeing lots of technological innovation, and we have been seeing that innovation for the last couple of decades. And so as a result, generally the infant mortality rate would be decreasing for Australia. Life expectancy, on the other hand, as a result of those said technological innovations and medical greater access to medicine and medical institutions, we would see that life expectancy is generally increasing. And in the graph that we saw earlier, we could see that life expectancy was on the increase. And so in this case, our answer will be A. So decreasing and increasing. So infant mortality is fortunately decreasing and life expectancy is increasing. And like I said, this is because Australia is a developed country with a strong public healthcare system that has access to a range of medical innovations. So that leads to decreasing rate of infant mortality and increasing life expectancy. And we saw that within the graph, but also we know that the life expectancy of males, for example, born between 2019 and 2021 is 81.3, so that's more recent, whereas for women it's 85.4, and that is in comparison to average expectancy of males that were born in 1890s, 1900s, being just about 51.5, and for women it was around 54.8. So we could see that generally the trend is increasing, and that was also seen in the graph earlier. So A is the correct answer here. So with multiple choice, it's always good to follow a method of elimination, because it just helps you feel quite confident with your choice. So let's now have a look at the second question. Which of the following identifies the measures of epidemiology? So this is a recall question, and hopefully you remember the 4 measures of epidemiology that we have talked about. So the first option is diversity, life expectancy, morbidity, and quality of life. Second option is infant mortality, life expectancy, morbidity, and mortality. Then we've got health status, incidence of disease, morbidity, mortality, and infant mortality, prevalence of disease, and quality of life. So within this, we can essentially begin, and this is from the 2022 HSC paper, so we can essentially begin by eliminating some of them. So firstly, we know that A would be incorrect because diversity, and this is a recall from your year 11 syllabus, diversity is a social justice principle. It is not a measure of epidemiology. And similarly, it affects the quality of life. The quality of life itself is not an epidemiological measure because it's not a quantitative measure. Because, yeah, that's one of the limitations with epidemiology, right? That it doesn't give us any indication on the quality of life. So we can eliminate A. B is looking good, but let's move on to C first. Let's see if we can narrow it down. So health status, incidence of disease, morbidity, mortality. Again, we know that incidence of disease, now it is a measure of morbidity, but morbidity includes both prevalence and incidence of disease. And health status, that is something that's been measured through the measures of epidemiology. Therefore, we can eliminate C, and then D we can also eliminate because, again, we've just got one element of morbidity here, so just the prevalence, and then quality of life, as we said, is not explained through epidemiological data. And so therefore, the answer here is B. So this question, simple recall question, and so B is the correct answer. Let's then move on and have a look at a short answer question. So this is from the 2017 HSC paper, and it's a 4-marker, and it is asking you to describe the limitations of epidemiology. So essentially, epidemiology, as we discussed, some of the key limitations there include the fact that it does not provide a holistic approach. It does not give us a holistic overview of life. There's obviously inequities with the resources being available to those in rural and remote areas to actually collect that epidemiological data and convey it in time. And we also spoke about how it is hard to collect epidemiological data that is recent, especially in cases of emergency. So in this sample answer, that's what we discussed, and this is a sample answer in the 2017 HSC paper. So epidemiology depends on valid data. This can often be difficult to obtain in emergency situations. Health workers in remote communities often lack the resources to conduct adequate data collection, and they lack access, and lack of access may also present difficulties in communicating these data in a timely manner. Epidemiology is constrained by rapid changes in the health status of at-risk populations. This is because by the time valid and reliable data is collected and analyzed, the conclusions for a course of action may already be late. So for this 4-marker, you would aim to have about 3 to 4 points, and we want to be giving examples and elaborating on them. So for example, not just saying that often health workers don't have resources, but elaborating upon that and linking that back to why is that a limitation? Because they don't have the health resources, they are unable to communicate that. They're unable to actually conduct epidemiological studies, and their lack of access prevents them from communicating the data in a timely manner. And so these were the 3 answers that we discussed, but other answers could also include variations within population groups. We could also talk about the quality of life, so the fact that it does not provide a very holistic approach. Whole picture, for example, the role of determinants, inequities that are experienced, and also the role of health determinants, that it does not sort of talk through them, give us insight into those. Okay, so that is it for this video. So let's have a look at what we did today. So firstly, we looked at multiple choice questions and strategies. We looked at the role of epidemiology, the distinct measures of epidemiology, the limitations of epidemiological data and studies, and also we looked at short answer questions and sample answers. So now you should be able to understand what are the measures of epidemiology, why is it important, what are the limitations of epidemiology, and be able to answer multiple choice and short answer questions regarding those. Wonderful, thank you.